so I'm going to be doing an NG feeding and an NG removal. So the first thing I'm going to do is I'm going to go over my patient's chart, look for any standard precautions that I need to take. I'm also going to check her order and make sure I know exactly what she's getting so I can prepare all of my supplies before I enter the room. When I enter the room, I'm going to go ahead and perform AIDIT. Knock, knock, knock. Good morning, Miss NG. My name's Gretchen. I'm your student nurse today. I'm going to be doing your NG feeding, and then I'm going to be doing your removal later. Do you have any questions? Okay. So I'm going to perform hand hygiene and make sure that the privacy is performed. And then, can you go ahead and verify your name and date of birth for me? Wonderful, thank you. I am then going to raise the bed up to a working position. And before I do any of my feeding, I'm going to go ahead and check all of my supplements, making sure I'm using the right supplement, making sure it isn't expired, doing all of my package integrity checks and whatnot. I am then going to go ahead and do a quick abdominal assessment before I start her feeding. I'm going to start by listening in each of the 4 quadrants, and then I'm going to palpate, looking for any pain or tenderness. Starting in the right and going to the left. Okay. And I'm going to go ahead and palpate in the same fashion, starting in the right lower, going to the right upper, assessing for any pain or tenderness. Does that feel okay? Okay. So I'm then going to assist the patient up to a 30 to 45 degree angle. I'm going to do a couple of steps to make sure the NG tube is in the same placement. I'm first going to measure the NG, what's outside, and I'm going to compare that to the documented length. I'm then going to aspirate just a little bit of stomach contents just to check for pH. So I'm going to take some of that out. I'm going to place it on a pH strip and make sure that it is the same color as the manufacturer for any pH of stomach contents. I am then going to put the syringe back in. If for some reason I couldn't get any stomach contents and I couldn't verify that the tube was inserted properly, I would notify the physician and have an x-ray done just to verify the tube placement. I am then, based on facility policy, going to go ahead and remove all of the stomach contents, looking for any food residual from the prior feeding, and upon company policy, put all of it back in, depending on what policy you were using. So once all that's done, I'm going to go ahead and irrigate the tube with 30 to 50 mLs of water. So we're going to pretend this is my water. So I'm going to do that, irrigate, making sure to hold up the tube, controlling the rate at which it is going in. So once that's done, the order states that I'm going to use 100 mLs of solution. So it'll be pre-poured in here. And so I'm going to make sure that I'm using that. Over a 30-minute base, I'm going to go ahead and administer the food. During all of this, I would have done hand hygiene and put gloves on. So I am going to administer the feeding, and then I'm going to go ahead and flush with 30 to 60 mLs of water, making sure it's all flushed. I'm then going to take this out, clamp it, and close it off. Making sure that the patient's feeling all right. I'm going to put it back on her. perform hand hygiene. As I said, I would have had gloves on when I was doing this in real life. I am going to make sure that this patient stays in the upright position for at least an hour after administering. I would also have put down the side rail while doing this. So make sure she's up. I'm going to come back in and do abdominal assessments afterwards, making sure that she's not nauseous, everything is going well. I would thank the patient. Thank you for letting me do your nasogastric feeding. I would make sure that her water and her call-light were by her. I would assess the surroundings and unprovide privacy. And so that's done. So once I'm finished with that and I had an order to remove the tube, I would again get all of my supplies together and check the order for the removal of the tube. I'm going to come into the patient's room. Knock, knock, knock. Hi. This would be up and the bed would have been down when I left the room prior. Hello, Miss NG. My name's Gretchen. I'm your student nurse. I have an order to remove your NG tube. Is that okay? And do you have any questions? No, okay. You're going to feel some slight discomfort, but it's only going to be momentary. I would identify the patient using 2 identifiers. I'm going to put that down, make sure the bed is in a working position, and that she was at a 30-degree angle. I would perform another abdominal assessment before I actually took it out. Once all that's done, I am going to measure the tubing again just to verify that it hasn't moved at all. So I'm going to measure this. Very good. In this scenario, the patient would be attached to suction, so I hypothetically already took her off of suction, and this is done. So I'm going to put a bath blanket or a towel on her chest, and I'm also going to give her a basin and some tissues because she's going to have to blow her nose afterwards. So I'm going to perform hand hygiene and put some gloves on while I do this. I would have put gloves on when I measured the tubing as well. Go ahead and start to coil up my line. So you're going to experience some discomfort. I'm going to have you breathe all the way out and then hold your breath, and then I'm going to quickly remove the tube from the patient. So go ahead and hold your breath. 1, 2, 3. Okay. Very good. I'm then going to discard it in this towel. I'm going to wrap it and place it in the proper receptacle based on facility policy. I would then ask her, I would remove my gloves and perform hand hygiene and put on a new pair. Ask the patient to blow her nose into a tissue. Ask if she's experiencing any discomfort, if she's good. These gloves are really small. So go ahead and blow your nose. Very good, Miss Angie. So then once that's all done, I would take off my gloves, perform hand hygiene. I'm going to lower my bed into a low position. Making sure that my patient is all taken care of. And put up the side rail, and then I'm going to go ahead and put it in the lowest position. If this were a multi-use bottle, I would initial and date. And then I would put on another pair of gloves, and I would measure the amount of nasogastric suction that was left, using a solidifier if I had to, and then documenting that and disposing it per company policy. I would then thank the patient. Thank you, Miss NG, for letting me take out your nasogastric tube. I would perform a visual safety check, make sure her call light and her water was by her, and then I would document all my findings.